Hello, my name is Abby Rubel, and I will be playing the role of the veterinarian.
Hello, I am JP Crowley, and I will be playing the role of the veterinary technician.
Hello, I am Blair Bennis, and I will be playing the owner of the dog.
Hello, I am Sabrin Digg, and I will be the owner of the beef cat.
We are the Maquoketa FFA Veterinarian Science CDE team, and this is our clinical practicum.
I was looking over my cattle today, and I noticed that Betty here was off of her feed, so I got her in the chute and checked her temperature, and it was a high temperature. And then I noticed she had some labored breathing and a snotty nose, so I thought I'd bring her in.
Well, thank you for bringing her in. It sounds like symptoms of pneumonia. We'll look her over and see if anything's wrong. If anything is wrong, we'll give her a broad-spectrum antibiotic. Supplies needed for a subcutaneous shot on cattle would be alcohol and cotton swabs for the injection site and for the top of the bottle, a 16-gauge needle, an automatic syringe, and the medicine required. When working with a large animal, it is important to have proper facilities to restrain the animal. This is just as important to the animal as it is to the person giving the shot. Even though a subcutaneous shot is painless, if the animal is startled and jerked suddenly, you can end up with an injured animal, an injured vet, or worse yet, a broken needle left inside the animal. Surgery may be required to remove it, resulting in a large expense to the owner and unneeded stress on the animal. In worst case scenario is the needle is lost in the animal, in which case the animal will need to be euthanized and properly disposed of. Having the animal restrained in a head gate and squeeze chute reduces the possibility of injury or accidents. It is important to keep all equipment clean and sanitized. Even though we are only making a small puncture into the skin, it is still an opening that can become infected. An ounce of prevention is worth a pound of cure. After examining your cow, we've come to the conclusion that she has a slight case of pneumonia. We will be giving her a broad-spectrum antibiotic, and we've calculated the weight of your cow at 1,200 pounds. This antibiotic requires 4.5 milliliters per 100 pounds, so we'll be giving about 55 cc's. You should see great improvement after this. The vet tech has already prepared the injection site and the syringe for the injection.
When giving a subcutaneous shot, first you're going to tent the skin and then administer the antibiotic. Following the beef quality assurances standards, you would want to give the shot in the neck to reduce any residues in the valuable meat cuts. When giving a subcutaneous shot, the first thing I did was tented the skin, and then I applied the shot at a 45-degree angle, making sure that it was a subcutaneous shot. After giving the shot, I checked the area to make sure that there was no abnormal bleeding in the area which I gave the shot. After giving the shot, I removed the needle, and then I will place it in the sharp.
After giving the shot to Betty, we loaded her up in the trailer for you. She should be good to go now, but if you have any problems with her where you need to sell her or slaughter her, be aware of the 28-day withdrawal time, so you can't do anything with her for 28 days. She should be good, but if you have any questions or concerns, you can call our office. Thank you for bringing Milo in today. He is due for his distemper shot. We're going to be giving him the shot here on the exam table, so if you're ready, we can go get Milo now.
Okay.
Our supplies needed for this practicum is a disposable syringe with a 25-gauge needle, alcohol, and a cotton ball for cleaning of the injection site, and a treat for the dog for after it is done. I have properly constrained Milo, and my vet technician is going to be cleaning the injection site.
Right between the shoulder blades, I will disinfect the injection site. And then I will administer the distemper parvo shot. Easy, buddy.
Tent.
I'm going to tent the skin, aspirate, and give the shot.
Good boy.
Good boy. Now I will take the needle off and place it in the sharps container. Then I will praise Milo for his confidence and taking the shot. There you go. Good boy.
I have given Milo his vaccination, and we will record it in the system and remind you when his next vaccination is due.
Okay, thank you. We'll see you next time.
We have demonstrated the proper way to inject a subcutaneous shot in both a large and small animal. We would like to thank our sponsor, Becker Veterinary Clinic, and the use of his facility and help with our procedure. Thank you again, Dr. Christian Becker.